Doctors are warning about a potential holiday surge in sicknesses after many of us gathered around the Thanksgiving table with a lot of people.
Cases of COVID, flu, and RSV are all rising, but there are vaccinations for all three respiratory viruses.
UW Health Chief Quality Officer Dr. Jeff Potoff is here for his weekly visit. Hi, Dr. Potoff.
Good to see you.
So,
is this alarming?
I don't know if it's alarming, certainly not nearly as alarming as it was during the pandemic, and we were really worried about holiday gatherings and what that would do for numbers. But I mean, at the same time, no reason to believe that we're not going to see more respiratory illnesses after a holiday like Thanksgiving, where we all go inside and eat turkey together. That'll probably happen.
We're seeing a lot, especially of RSV. The CDC said there's been a sharp rise in cases across the country and here locally as well.
We're starting to see the rise here. So certainly other parts of the country are kind of in the thick of it. Here, our RSV cases are just starting to rise. No reason to think that that won't continue now for the next couple of months before it kind of peters out, probably sometime in February. But yeah, RSV is in the community right now.
But there are 3 vaccines for it now.
You know, there are. We went from nothing for RSV last year to, if you're over 65, we have the older folks RSV vaccine, prevents hospitalization. If you're pregnant and you're going to give birth in the next couple of weeks, we have that vaccine that then protects your infant from RSV for that first RSV season. And if you have very young children, not a vaccine, but something that acts much like a vaccine, antibodies, which you can get that injection that stays in your system, fights RSV for about 6 months, protects those young kids. So a plethora of options to protect yourself against RSV this year that we didn't have last year.
How do you know which one you have? If you have RSV, is it pneumonia, RSV,
Because
COVID?
it all starts like a common cold, doesn't it?
I'll let you in on the doctor's secret. We order a test and it tells us, because otherwise you can't really tell early on
it's all sort of
which one it is. Yep.
Kind of the same?
When you come in and we're going to test you for a respiratory illness, we're usually testing for influenza A, COVID, and RSV. When you first come in, they're almost indistinguishable. There's enough variation between them where you can't tell.
So for parents, is that your advice, to just bring your child in to figure out what it is?
So not so much. This is going to sound crazy, but for most people, doesn't matter which one you have. Whether you have RSV, influenza, or COVID, don't get anyone else sick, so stay home, cover your cough, stay well hydrated, Tylenol, ibuprofen for aches and pains. It's when you get more ill, so you're starting having trouble breathing, things like that, that would be the time to take it in. And then we test, because there's different treatments for influenza, Tamiflu, things like that. For COVID, we've got Paxlovid, and for RSV, we say, sorry, there's nothing that we've got for you, but here's some supportive care.
Well, that's great news. There's nothing you can do about it. Are we seeing pockets around the country where it's worse than others?
We see that kind of the little pockets, typically with a lot of respiratory illnesses, and I don't know why it is, but the Southeast typically starts to light up first. That's kind of like our canary in the coal mine, and then we see it kind of come across, and that's kind of been what it's been like this year. We've been hearing about RSV, COVID, even influenza, kind of Southeast United States, and now the last couple of weeks we've seen those viruses uptick here in Dane County too. Influenza being the one that's probably sharpest on the rise, COVID increasing, and RSV just starting its upward trajectory.
Are you too late to get a flu shot or to get your COVID vaccine if you still want to get those vaccinations?
Not too late, but at this time too, this is where folks will sometimes say, well, I got vaccinated and then I got pick your disease. Well, that's because you got vaccinated while these things were in the community. You probably ran into the virus before you had your protection from your vaccine. But you always have the chance of getting vaccinated, and then you run into the actual virus. You might have some symptoms, but you're probably not going to get as sick.
So it's a 2-week lag or so between the shot?
About 14 days is a good way to do it, yeah.
So the shot will lessen the severity of the illness?
Yep, if you don't catch it for the 14 days between your shot and when you get your disease.
Here we are, 3 years later.
I know, we're still talking about it.
We're less stressed about it, I think.
Absolutely.
I think the vaccine, I mean, there's no vaccine at first, and nobody knew what was happening.
And people, I mean, people are not gathering.
Well, right, and the percent of people getting really sick is much, much less than it was before. Not to say some people don't get really, really sick, but it's a different world than it was during the pandemic.
If you don't feel well, stay home.
Absolutely.
Doctor, thanks for being with us.
Thanks, Dr. Potoff. Good to see you.